This is a musculature anatomy review of the shoulder, focusing on the rotator cuff muscles. The rotator cuff, also known as the sits muscles, are the major dynamic stabilizers of the shoulder. There are 4 rotator cuff muscles: the supraspinatus, infraspinatus, teres minor, and subscapularis, which, if you use the first letter of their names, gives you the acronym SITS, S-I-T-S. Beginning with the posterior cuff muscles, these make up 3 out of the 4 rotator cuff. So looking at the posterior aspect of the shoulder, we have from superior to inferior the supraspinatus, infraspinatus, and teres minor. The supraspinatus muscle originates within the supraspinous fossa of the scapula and inserts onto the superior facet of the greater tuberosity or tubercle of the humerus. Notice its almost straight north-south orientation as it inserts onto the humerus. This is important when palpating for the insertion and tendon of the supraspinatus clinically. The supraspinatus is innervated by the suprascapular nerve, which runs within that suprascapular notch. Its blood supply comes from the suprascapular artery, and its action is to initiate abduction, and probably more importantly, contraction of the supraspinatus holds the humerus within the glenoid fossa. So it helps to compress the humeral head against the glenoid and maintain articulation. Inferior to the spine of the scapula, we find the second posterior cuff muscle. This is the infraspinatus muscle. The infraspinatus has an origin on the infraspinous fossa of the scapula. And as you can see, it inserts onto the greater tubercle or tuberosity of the humerus. The infraspinatus is also innervated by the suprascapular nerve, and its actions are to as well hold the humeral head against the glenoid fossa, but because of its more lateral orientation, the infraspinatus, is also going to be an external rotator of the shoulder. Lastly, within our posterior cuff, we have our teres minor. The teres minor originates along the superior part of the lateral border of the scapula and a little bit of the infraspinous fossa, and it inserts onto the inferior aspect of the greater tuberosity of the humerus. This muscle is innervated by the axillary nerve, and its action is to externally rotate the shoulder, assist with a deduction, and similar to the supraspinatus and infraspinatus, it also serves to compress the humeral head against the glenoid fossa to maintain stability within the joint. If we look at the 4th of our rotator cuff muscles, the last S in sits, this is our subscapularis, which is seen anteriorly. It has an origin along the subscapular fossa of the scapula and inserts not on the greater tuberosity of the humerus, but the lesser. This muscle is innervated by the subscapular nerve, and when it contracts, has the action of internal rotation of the humerus. And similarly to the posterior cuff, this muscle assists in holding the humerus against the glenoid fossa.